Hello everyone, welcome back to the channel. In today's anatomy lesson, we will be discussing the surface anatomy of the anterolateral abdominal wall. Understanding these landmarks is essential for physical examination, surgical procedure, and interpreting clinical findings. By the end of this video, you will be able to identify major abdominal wall landmarks and understand their clinical significance. Let's get started. The first landmark is the umbilicus, commonly known as the belly button. This is the site where umbilical cord enters the fetus during development. In adult, it serves as an important reference point for abdominal anatomy. Clinically, umbilicus line at the level of L3, L4 intervertebral disc and correspond approximately to the T10 dermatome. However, its exact position varies depending on age, body habitats, and the amount of subcutaneous fat. Because of its consistent location, umbilicus is often used as a central landmark during abdominal examination. Another one is Linea alba. Running particularly through the center of the abdomen is the Linea alba. It is the fibrous structure formed by the fusion or aponeurosis of the abdominal muscle. External oblique, internal oblique, and transversus abdominis. It extends from the Xiphoid process of the sternum superiorly to pubic symphysis inferiorly. This Linea alba divides the abdomen into right and left half and serves as important surgical landmark because it contains relatively few blood vessels. And section 3 is the pubic symphysis. At the lower end of the Linea alba lies the pubic symphysis. This is the fibrocartilaginous joint connecting right and left hip bone. Although it is often covered by soft tissue, it can be palpated in the midline of the lower abdomen and pelvis. Pubic symphysis, it is an important landmark for pelvic and lower abdominal examination. And then iliac crest and ASIS, or anterior superior iliac spine. Moving laterally, we encounter the iliac crest. Iliac crest is the superior border of the ilium, and it is one of the easiest bony landmarks to palpate. Its highest point generally corresponds to the L4 vertebral level, which is clinically important during clinical procedures such as lumbar puncture. Anteriorly, iliac crest and at the anterior superior iliac spine, also known as ASIS. ASIS serves as attachment point for several muscles and ligaments and is frequently used as a reference point in physical examination. And another one is semilunar lines. In individuals with well-developed abdominal muscle, calf groove can often seen on either side of rectus abdominis muscle. These groups are known as semilunar line or linear semilunaris. They make the lateral border of the rectus abdominis muscle and its sheath. Semilunar line extend from lower region of lower costal margin down to the pubic tubercle. Semilunar line, lower costal margin to pubic tubercle. These visible lines help define the characteristic appearance of anterior abdominal wall. And another one is tendinous intersection. Rectus abdominis muscle contains several horizontal fibrous bands known as tendinous intersection. These intersections divide the muscle into segments and create the appearance commonly referred to as six-pack. On the surface of the body, the intersection may appear as a transverse groove crossing the rectus muscle. These are important anatomical structures and have identified different segments of rectus abdominis muscle. And then serrated anterior muscles and external oblique muscle. In athlete individual, the interdigitating muscle fiber or serrated anterior and external oblique muscle may be visible along the lateral abdominal wall. These muscular contours contribute to the definition of the trunk and are often used as visual indicator of muscular development. Understanding these muscle boundaries help clinicians accurately identify underlying anatomical structure. And let's study about the inguinal groove. Another important surface landmark is the inguinal groove. This groove corresponds to the location of the inguinal ligament, which extends from ASIS to pubic tubercle. This is the inguinal groove. Inguinal groove marks the transition between the lower abdomen and upper thigh. Clinically, this region is extremely important because inguinal hernia commonly occur near this area. Okay, let's quickly review the key point. Umbilicus located T10 dermatome and L3 L4 level. Linea alba extend from C5 process superiorly and pubic symphysis inferiorly. Iliac crest highest point correspond to L4 vertebral level. Semilunar line mark the lateral border of rectus abdominis muscle. Inguinal groove indicate the location of inguinal ligament. Okay, if you found this video helpful, please like the video, subscribe to the channel, and turn on notification for more anatomical and medical education content. Thank you for watching. I will see you next lesson.